Paging Dr. L. Paging Dr. L. Come in, Dr. L. Paging Dr. L. Well, I'm here, ladies and gentlemen. They're paging me. I guess I got a body. Well, let's start treating this body, all right? Bring me my patient. Okay, so I see the patient. What we going to do today? Well, doc, we're going to perform some surgery. All right. Let me get ready. All right. What we got? Give me the stats. Well, doc, we got a body of artwork that needs to be disemboweled and then reassembled. How you going to do it? Excellent question. Bring me my toolkit. What's in my medical toolkit? You're going to need these medical shuriken. We're going to leave the gua sha tool out of this. Essential oil maybe for some body work. Acupuncture needles, probably as an anesthetic. What else? But you know what? We can always calm a person down with some CBD. All right? You know what? What else do we got? Well, we could try some suction cups, but you know, we really need to just disembowel this body, doc. All right, let's get to work. Let's strap this patient down. Yes, I know what you're thinking. I'm having way too much fun with this little video. Yeah, I am. And why not? Learning can be fun. It almost looks like I'm catching a body for real though, right? Over here doing this thing. You know, gotta make sure that the patient is stable and stationary. We don't want any random wild movements. Alright. I guess this tape acts like the anesthesia, because I'm pinning it down, baby. We're going to put a couple more pieces on this here body, so that way we make sure that the body doesn't move with these acupuncture points. 4 pieces of tape, similar to a 4 doors treatment. 4 doors treatment, that would be large intestine 4, coupled with liver 3. These are the chi and blood points. So if we sedate the chi and blood points using large intestine 4 and liver 3, we'll be able to sedate and calm the patient. All right. Well, we're going to need an extra one for deeper penetration and sedation. So let's go ahead and make sure that we add on to this yin tong. 5th point. Where's yin tong? 3rd eye position. Bomb. We got our 4 doors. Liver, large intestine 4, liver 3, yin tong. The patient is now sedated. Doc, we need you to cut this patient open now. I'm ready. Where are we going to start with this first incision? We're going to begin our first incision at the liver and diaphragmatic point. This is the easiest place of access to gain entry into the yin or deepest organs. Making first incision. Patient is calm, no adverse reaction, no wild movements. Now, the liver is in charge of processing bile, but it does so by processing cholesterol. The cholesterol that enters the body is, again, and thereby filtered by the liver, one of the body's primary filtration systems. The liver also works with the pancreas and the spleen. And in doing so, it ensures digestion and proper breakdown of macronutrients and micronutrients. I think we've been able to successfully make the extraction. Go slow, doc. Go slow, doc. Patient is still stable. Now, with the liver and pancreas performing their digestive enzymatic functions, breaking down cholesterol and placing those nutrients back into the bloodstream, those digestive enzymes enter into the small intestine via the common bile duct, in which case within the small intestines, acidic food-based substances passed on to it from the stomach can be easily alkalinized and more easily, readily digested, metabolized, and enter into the bloodstream. We've successfully extracted the liver, the gallbladder, the pancreas with a portion of the spleen, and the small intestine. Doc, what's next? What's going to be the next extraction point? Well, we're going to save the heart for last because we're going to need this heart to continue to pump this blood. So we're going to, while we're thinking about what the heart is going to do, we want to ensure that the heart still maintain calmness through the large intestine 4 points and the liver 3 points. Energy and blood flow. Chi and blood. Chi and liver, large intestine 4. Blood and liver 3. Calm, sedated mind, yin tang. Save the heart for last. What's going to be next on this list? We're going to go ahead and remove the stomach, spleen, and a portion of the pancreas and myenteric artery. All right? Now, the spleen and stomach, its job is to transform and transport food stuff that has been broken down into more readily digested substances to enter into phase 1 digestion in the liver and then further be processed and broken down in the small intestine. Doc, go slow. Go slow, Doc. We want to make sure that the patient isn't overwhelmed with this information. Good point. Excellent point, nurse. Excellent point. My physician's assistants out there, let's go a little bit slower. Think of the spleen and the stomach as alchemists. They take one substance, break it down, and convert it into a much more readily used substance by the body. We got to go slow on this upward incision. Because whatever it is that goes into the small intestine should never, ever go in reverse or up. Otherwise, substances contained in the small intestines, inclusive of bile and other undigested material that may have been converted further fermented, as it were, in the digestive process, is thus able to cause a reflux or regurgitative action. Let's go ahead and extract the stomach and the spleen with a portion of the myenteric artery, which is what feeds the spleen and stomach its blood flow. Now again, the stomach and spleen, they tend to enjoy warm temperatures. And mostly because it's constantly dealing with hot substances or substances that have been increased in metabolic activity through the digestive process that has already been initiated by both the mind and the mouth. So here we go. The spleen in Western medicine is also the storage point of all lymphatic fluid, white blood cells, and a blood supply in case of an emergency. And we have successfully and safely extracted the spleen, stomach, mesenteric artery, which feeds the blood supply into the spleen and stomach, and the largest portion of the small intestine, which has a deep connection with the heart, because the substances digested, broken down, and that are entering into the venous flow that is going to return to the heart is going to be digested and processed mostly there in the small intestine. Doc, what's going to be the next organ that we're going to be extracting out of this body? Excellent question. We're going to go ahead and go for the lungs and the large intestine. Now, we got to be careful with the lung and large intestine because they're controlling respiratory functions. I know people might be wondering, how does the large intestine regulate respiratory functions? Well, the majority of gas exchange occurs in both the lungs, the large intestine, and the kidneys. The large intestine stores gut flora, which are essentially bacteria, living organisms that are breaking down substances into more easily or valued substances for the body, such as vitamin K. Now, vitamin K being produced or mostly absorbed in the large intestine is essential in the coagulation process. So we have to be extremely careful with removing the large intestine, because if we remove any portion of the large intestine, we remove a portion of the digestive system's natural gut flora, which is essential to the production of vitamin K, which would in turn also cause coagulation or the blood stoppage during injury. Now that we performed our surgical incisions, let's go ahead and perform this extraction. Now, the lungs, being the processor of oxygen and oxygenation, it returns oxygenated blood to the heart, thus controlling the respiratory functions of the body is extremely essential when considering how a body may be processing, metabolizing, or experiencing oxygen and oxidative stress. Something else to be notated is that the appendix is attached to the entry of the large intestine. And it's also essential to note that the appendix, being the storage facility of those bacteria that break down substances that are converted into vitamin K, the appendix should be removed safely and efficiently. Now that we've extracted the lungs and the large intestine along with the accessory gland, also known as the appendix, we're going to go ahead and extract the kidneys along with the urinary bladder and majority of the reproductive organs. Now, as I stated before, with the liver being a filtration for fats and cholesterol, the kidneys are a filtration of fluids, specifically the plasmic fluid. And the plasma is what all red blood cells and white blood cells are floating around in. Now, without a healthy kidney to filter the body's blood and also maintain a healthy pH balance, which is essential to healthy blood circulation, any negative or adverse events that may affect the kidney, such as high sugar intake or high protein diets or high sodium diets, in contrast to modest diets of the same, will have a negative impact on reproductive as well as fight, flight, rest and digest endocrine functions. This can also lead to adrenal fatigue, which in turn can also lead to other hormone specific or related disorders, such as the malabsorption or processing of estrogen and the proper conversion of progesterone and androgen into testosterone. We've made our surgical incision around the kidneys, the urinary bladder, and the reproductive organs. Let's go ahead and perform this safe and efficient extraction of those same organs. Now, the kidneys are also the dominant controllers of the adrenal glands. All right? The adrenal glands also manipulate or influence the reproductive glands. Without a healthy fight or flight response, male ejaculation is not possible. In like turn, an overstimulated adrenal gland in women may inhibit monthly menstrual cycle flow and function. Now, it's also especial to note that the kidneys control the body's or regulate the body's metabolic substances, its electrolytes. Essentially, the substances that are in connection or in combination with some form of sodium or sulfate. This is a kind of a rough extraction of these reproductive organs. We got to be careful around these in this particular case around the ovaries. All right, the ovaries, the fallopian tubes are very sensitive and delicate tissues and organs. The ovaries contain the majority of the egg cells that each and every woman was ever born with until maturization, and then released monthly during the ovulation period, which is when a woman's body is secreting luteinizing and follicle stimulating hormones, which influence an egg's ability to attach to the uterine wall to create the connections that will be essential in the formation of the placenta, which will be the network of blood vessels that feed the amniotic sac, which will house the embryo of the developing child. Again, we got to be extremely careful and cautious with this surgical procedure. All right, because again, the ovaries are sensitive as well as the testicles. We also got to make the testicles in men also help to regulate temperature. All right, most men are not aware that temperature can also influence the death cycle of a semen cell. How so? Once the body reaches a certain temperature during intercourse, the body then stimulates the release of prolactin, a hormone that is essential in the ejaculation process for men as well as in the lactation process for women. Prolactin, which is secreted by the pineal gland. So maintaining a healthy blood flow is extremely essential in healthy reproductive systems. And we've successfully extracted the kidneys, the urinary bladder, the female ovaries, fallopian tube, uterus, and the male testes, as well as the prostate, which is the gland that is needed at or acts as a pump and mechanism to draw the semen from the testicles into the bladder for ejaculation or excretion into, you know, the uterus. All right, which brings us back to the heart along with the mind. Here we go with having to remove yin tang. We still going to be maintaining sedation of the energy with large intestine 4 and of the blood flow with with liver 3. All right, we're going to begin with extraction of the heart first, because as long as the brain still retains some level of oxygen, it will be able to survive separated from the heart for a period of up to 3 hours, as long as we maintain an electrical stimulation. And to maintain electrical stimulation, I also have my electrical stimulation set up connected to, again, large intestine 4, liver 3. Set my system and my dials. Checking the pulse. All right, let's go ahead and go. Into the heart I go, making my first incision superior to the superior infina vena cava, which is one of the return ports of blood flow, moving inferior and transverse across the inferior vena cava, inferior of the main cardiac wall of the left ventricle, superior, and here we'll make our connections into the brain, or begin to sever those connections of the brain from the body. And it seems as though we're having a little trouble extracting the brain. And we've already made our connection through the cranial wall, which is composed of bone marrow. So healthy bone marrow is essential to healthy encephalic function and cognitive development. Without the kidneys being able to get those essential salts and the liver being able to regulate those essential sugars, with the pancreas's ability to convert those essential sugars into usable energy via insulin, glucagon, and glycogen, well then, the brain is going to begin to, through its nervous system, will be influenced to stimulate the release of white blood cells, in which diet is extremely important to healthy brain function, because the hormones that are secreted and absorbed in the digestive system, like serotonin and dopamine, will influence a person's well-being. Now, again, speaking of the digestive enzymes, the heart uses calcium as a contraction or a contractile substance, and it's with calcium acting as a muscle contraction, it also uses substances like magnesium, phosphorus, and potassium to relax the cardiac muscles. Whereby sugars can negatively impact the absorption of calcium as well as the absorption of magnesium, phosphorus, and potassium, which may induce or be a dietary factor in high blood pressure and cardiac arrest. And of course, because the heart is what is pumping blood via the jugular veins to the brain, any poor sugars that would occlude or poor fats in the form of low density lipids that would occlude arterial and venous blood vessels would also influence the absorption of oxygen from the blood into the brain, which would cause an oxidative stress and stimulate again the kidneys to produce adrenaline, in which case the immune system's functions decrease and the digestive systems begin to shut down. We have successfully extracted the brain from this body. Doc, we're going to need to go ahead and reassemble this body. Let's go ahead and begin the reassembly process. From the heart, we know that the heart's going to need oxygen to pump to the brain before anything else. So, let's give this body some lungs, so that way we can ensure oxygenation of blood to the brain and the heart and the rest of the muscular tissues. And we also know that we're going to need a large intestine We're going to need the large intestines to go ahead and make sure that vitamin K is being absorbed in the digestive system. Right? Because the heart sits in between the lungs. And of course, we need those large intestines to go ahead and do what? Absorb that vitamin K and make sure that coagulation can occur in the event of injury, right? Meaning the body will form a scab. But not only that, we want to make sure that anything that is digested is able to be eliminated and excreted from out of the body. So we need those large intestines. What else are we going to need? We're going to need those healthy kidneys to regulate that nervous system response. Right? In order to fight, flight, or flee, excuse me. And in the instance where we're trying to make some babies, do the affection thing, you know? So we want to make sure that we put those kidneys in there as well, along with those healthy reproductive organs. You know what? I'm going to put the large intestines on top of the kidneys because That's really how it works. If I'm really putting his body back together, remember the kidneys are also filtering blood, right? Large intestines is doing the elimination thing, right? But it takes the large intestine doing that elimination thing, and we're going to put this slightly lower than the bladder here. That way it doesn't seem as though we're excluding those functions. But let's go ahead and make sure that the digestive system is healthy and functioning, right? Because without the digestive system, the spleen, the stomach, and the small intestines transforming and transporting those vital substances into nutritional things, so that way we can maintain a healthy level of energy in order to perform whatever our necessary and daily work may be. We're going to go ahead and put these digestive organs back in there, right? And it sits in the center. Now, we want to make sure that the stomach is not taking on, it's not just breaking stuff down. We want to make sure that the body is able to break it down even better. And that's going to be those substances, those fats, those sugars, those proteins. We want to make sure that those things are able to be broke down by the liver and the pancreas. So let's go ahead and put the liver back up there with its bile storage device called the gallbladder, right? And we're going to also make sure that we put back in there the pancreas, which produces those digestive enzymes, and also has a strong connection to the spleen and the stomach, because the endocrine functions of the pancreas helps the spleen and stomach break down old white blood cells in the spleen and sugars, fats, and carbohydrates processed by the stomach that are entering into the small intestine. So we're going to go ahead and make sure that we put the liver, gallbladder, and small intestines back in there. And let's go ahead and start bringing our patient back out of it. Let's go ahead and, we're going to go ahead and disconnect our electrodes. So we're going to take off our electrical stimulation off large intestine 4. We're going to take our electrical stimulation off of liver 3, right? And what do we have left over? Now that we've removed our electrical stimulation, we got to remove our points. We're going to leave yin tang in there because we want to leave this patient sedated until we're ready to bring them all the way out. But let's go ahead and allow blood flow to start self-regulating by removal of liver 3 first. We're going to take off liver 3. All right. And I'm showing you how to reassemble a body. Dr. L done caught a body so you don't have to. All right. Dr. L caught a body so you don't have to. All right. And we're doing that. We're bringing this body back to life by removing liver 3, so that way we can increase blood circulation, let the body start regulating it on its own. We're doing this gently, because this body of work, it's delicate. It's delicate and it's fragile. All right. For those of you who weren't able to check out the whole, surgical extractions of these vital organs, definitely be sure to check out the live video later on. You'll see me catch a body. Baby, you're going to see me catch a body, but you're going to see me put it right back together. All right? So again, delicately and as gentle as possible. Even in Eastern medicine, sometimes, things get a little rough. But we doing this holistically. We using the body's natural functions to do itself, right? So we got the blood flow circulating back. Let's go ahead and remove large intestine 4. Let the energy start recirculating back on its own functions, on its own. And this was just my little traditional Chinese medicine variation to showing you holistically how the body works, how we put it together, how we take it apart, but again, most importantly, how we put it back together. removing the last large intestine 4-point as delicate as I possibly can. And hey, I don't own the rights to any of the music that you heard in this video. Don't be mad at me, please. You know, Instagram, TikTok, any place else. You know, I just need to make it interesting. It's been for educational and informational purposes only, not to circumvent or you know overdo somebody else's information. It's just this is just information to empower and give people access in the most common forms that they can find, even on social media. Please be sure to like this video. Give it a thumbs up if it's on YouTube. Share it with your Instagram and Facebook family. For the portions that get broke down into reels on TikTok, be sure to share it. Helps out with the algorithm. I appreciate your time. Again, Dr. L Quarterbody, so you don't have to. If you like this video and you like this piece of my body of work, this art that I actually drew and just like performed surgery on, I'm actually going to be magnetizing this. And I'm going to be laminating and magnetizing this so that way you can do something of similar nature for yourself, all right? It's a fun way to learn things, all right? And, of course, each different organ is going to be paired with some information to show you how those organs function and work with other organs, all right? So, Dr. Prince L giving you this information out of the love because it makes me happy. Peace.